Hello, I'm Dr. Nandini, Senior Consultant Gynecologist at Akineni Hospitals. Wishing you well. In this session, I'll highlight some important points. Please stay tuned and take notes.
Welcome back, Focus Learners. I am so incredibly excited to guide you through today's explainer because we are tackling a topic that touches literally millions of lives globally. Today, we're taking a structured journey through breast cancer. But look, this isn't just going to be some dry clinical overview of a disease. This is really a story about the incredible power of modern science, the sheer resilience of the human spirit, and that profound journey from a diagnosis all the way to the hope of long-term survivorship. Greater than 99%. I just want that massive number to really sink in for a second. This overwhelmingly positive figure, that is the 5-year survival rate when breast cancer is detected early, before it's had the chance to spread beyond the breast. It's an absolutely astounding statistic, and it completely frames everything we are going to talk about today. Modern treatments and early detection mean it is no longer the death sentence it once was. I love this quote because it completely flips the script. Our whole theme today is empowerment. A breast cancer diagnosis used to carry a very different, much darker weight. But thanks to just relentless scientific breakthroughs and a massive global push for early screening, we've completely transformed how we view and approach this diagnosis today. So, to make sure we really grasp this, here is our roadmap for the explainer. We'll be covering what is breast cancer, assessing your risk factors, the power of early detection, navigating the treatment journey, and finally, life after treatment. All right, let's jump right into part 1. What is breast cancer? At its most fundamental level, cancer begins as abnormal, completely uncontrollable cell growth. In the breast, this rogue growth typically starts in specific tissues, like the lobules, which are the glands that produce milk, or the milk ducts. Now, understanding the specific type of cancer is everything. Let's break down this biological alphabet super bit. First, you have ductal carcinoma. This is the most common one, making up about 80% of cases. Then there's lobular carcinoma, which starts in the lobules and can actually be a bit trickier to spot on a mammogram. But then we also have to look at the receptors. HER2-positive cancer is driven by an excess of the HER2 protein, while hormone receptor-positive cancer is fueled by estrogen or progesterone. So the really crucial takeaway here is this. Identifying this exact biological signature is what dictates the entire treatment plan.
You might have also heard of this specific type, triple-negative breast cancer. It gets that name because it literally lacks all 3 of those key receptors we just mentioned, estrogen, progesterone, and HER2. Because it doesn't have these receptors, standard hormone therapies just don't work, making it traditionally a more aggressive type of cancer. But there's incredible news here. Recent massive advances in treatment have vastly improved the outcomes for patients facing this specific diagnosis. The landscape of hope is expanding every single day, for sure.
Moving on to Section 2, assessing your risk factors. Whenever we talk about risk, I want you to mentally divide the information into 2 buckets. Bucket 1 is the unchangeable biology. Being female makes you 100 times more likely to develop breast cancer than a man. Most cases occur in women over 50. Then you've got family history, then breast tissue, and specific genetic mutations like BRCA1 and BRCA2. You simply can't change those things. But then look at the second bucket, the factors we actually can influence today. Physical activity, maintaining a healthy weight, and limiting alcohol and smoking. These are totally actionable lifestyle choices that put the power right back into your hands. We also need to briefly touch on hormonal exposure. Your reproductive history, like starting your periods before age 12, going through menopause after 55, or having your first child after the age of 30, can slightly elevate your risk. Prolonged use of combination hormone therapy does the same thing. Basically, it all comes down to the total length of time your body is exposed to certain hormones over the course of your entire lifetime. Okay, Section 3. This is absolutely critical, the power of early detection.
I literally cannot stress this enough. Finding the cancer early changes absolutely everything. Remember that huge number from the very beginning of our explainer? When cancer is localized and found before spreading, the survival rate is practically 100%. But if it has had time to spread to distant body parts, that rate falls to about 30%. That contrast is completely life-saving, and it perfectly highlights exactly why early detection matters more than almost anything else.
So how exactly do we catch it early? Well, it's a very logical progression. Step 1 starts right at home with routine self-exams. You need to know what your normal baseline feels and looks like so you can spot any sudden changes in size, shape, or texture. Step 2 involves clinical exams during your regular doctor visits. And Step 3 is mammography, those specialized X-rays. Women at average risk should generally start getting these screening mammograms between the ages of 40 and 45. Now, if a mammogram or clinical exam does find an abnormality, the very next step is a biopsy. A small tissue sample is taken, and this generates a pathology report. Think of this report as, well, it's basically the ultimate GPS system for the medical team. It tells them the exact type, the grade, meaning how fast it's growing, the receptor status, and the stage. It is the essential roadmap they need to build a completely personalized treatment plan.
Which brings us to Section 4, navigating the treatment journey.
Look, if you or a loved one receives a diagnosis, it is going to feel incredibly overwhelming. There's no way around that. But by mapping out the standard sequence of treatment, an intimidating process really turns into a highly structured, predictable path. Generally speaking, modern treatment begins with surgery to physically remove the tumor, followed by chemotherapy if it's needed, then radiation, and finally, long-term hormone therapy to prevent recurrence.
Let's look a little closer at that surgical phase. The primary goal here is straightforward: removing the cancer while checking to see if it's spread. Options range from a lumpectomy, which carefully removes just the tumor and preserves the breast, to a mastectomy, which removes the entire breast. Alongside this, surgeons will typically perform lymph node surgery to ensure no cancer cells have escaped the immediate area. It's an incredibly precise, tailored approach.
Following surgery, the medical team deploys their treatment arsenal. Radiation uses high-energy beams to target any microscopic cells that might have been left behind. Chemotherapy uses systemic drugs to hunt down cancer cells throughout the whole body. And yeah, while chemo can definitely have tough side effects, modern supportive medications have made it so much more manageable today than it was in the past. Finally, we have the true marvel of modern medicine: targeted and hormone therapies. For example, a drug like trastuzumab acts like a guided missile for HER2-positive cancers. Hormone blockers might be taken for 5 to 10 years, acting as this amazing long-term precision medicine.
And that leads us to our final section, Section 5, Life After Treatment.
As we move into the most inspiring phase of this whole journey, before we even talk about physical recovery, we absolutely must acknowledge the emotional toll. Going through a cancer diagnosis and treatment is immense. It is every bit as real and challenging as the physical side effects. Having an active, robust support system, friends, family, specialized support groups, and professional counselors is not just some nice bonus. It is an absolute necessity for healing. Entering survivorship really means navigating a new normal. Yes, it absolutely involves regular follow-up care. And yeah, it often means managing long-term physical changes, like lymphedema, which is arm swelling, or neuropathy, a lingering numbness or tingling. But what is truly remarkable is that so many survivors emerge from this crucible with an incredibly profound, deeper appreciation for life and radically clearer priorities. It is such a beautiful testament to human resilience.
And you know what? The future only looks brighter. Survival rates just keep climbing year after year, and it is entirely thanks to advancing science. We are seeing constant breakthroughs in precision medicine, the incredible rise of immunotherapy, which actually trains your own body's immune system to fight the cancer, and ever more sophisticated genetic testing. Science is winning this battle, guys.
The science is incredible, and the treatments are highly effective. But early detection? That relies entirely on you. So, I'm going to leave you with this. Are you truly up to date on your screenings? And whose life might you change today just by reaching out to support a survivor in your own community? Take a moment to really reflect on that, take action, and I'll see you in the next explainer.